let's go over some hand positioning for your partner during labor. So we're in those early stages, those first stages of labor, we actually want to open up towards the top of the pelvis. So the reason for that is baby's actually up quite high in the pelvis. It needs to work their way slowly down. So that first stage, you're walking around, we're not ready to push yet. We're just trying to get baby to come slowly down and use gravity to help baby descend. So this is the time where things like hip openers or opening up the hips can help. We're trying to widen the top of the pelvis. So mom's coming into positions either on her partner or squat positions using the chair, doing hip openers to open up. Now, if I want to open up the top of the pelvis or help my partner alleviate some pressure at the top of the pelvis, I want to have my hands down low on the pelvis. So here we're kind of off to the sides. I can show you on myself, you'd be down kind of closer to the sides or a little bit further in, but down low on the hips. Now, as baby starts to work their way further down, and we actually get baby engaging further down into the pelvis, that's where we want to start to open up further down. So we're actually trying to create space between those two sits bones. So the bones that we feel as we're sitting on our chair, we want to create some space there. So in order to create space there, that's as we're slowly getting closer and closer to pushing. The knees are brought in a little bit further rather than being further out. So knees in, we're going to widen towards the bottom of the pelvis. And your partner can help you by applying a little bit of pressure higher up towards the top of the pelvis or right around the crest, the tops of the hips. And that's going to create space at the top of the pelvis. So we're starting off low on the hips and working our way up higher and applying pressure higher up onto the hips. You can also do it over the tailbone and applying pressure a little higher if that's comfortable as well. So how do I know? How do I know where baby is and if I'm putting pressure in the right spots? Start off low, work your way up higher, and it's going to feel good. If you're taking off pressure, it's going to feel better. If you're in the wrong spot, maybe I'm a little too high, maybe he's not ready for that yet, it's going to feel like more pressure and feel worse. So start off low, work your way up, and at that spot where, yeah, that feels good, that feels like it decreases that discomfort, you're in the right spot.